Hello and welcome all of my students to this wonderful session. I have two very esteemed guests with me who have cleared their NBE Diploma exam. They were the first NBE Diploma holders in India, which in itself is a big achievement. Dr. Anu Parvati and Dr. Garima, I welcome both of you.
Thank you.
Now, both of these students are a part of the WhatsApp group that we have of the Resident Masterclass, and they have been very active in the last 1 year when I was teaching, and they were always very upbeat about their exam. And finally, I'm also getting a privilege to see them and talk to them. So, welcome to both of you.
Thank you so much.
Thanks a lot, sir.
Let's start by talking about your journey. Tell us about yourself, Dr. Anu and Garima. कहाँ से आपने चालू किया? From where you did MBBS and how did you go about and reach this place?
Sir, I did my MBBS from Government Medical College, Kota, and then I take 2 drops. It was COVID time, so the exam was already delayed, and then I got this NBMS Diploma Anesthesia from Narayana Hospital, Jaipur, in my first round only. So I am basically from Jaipur, so I said yes to it, okay. But I was a little unsure about the term diploma at that time. But later on, I discussed with my many colleagues and friends. So they said that, okay, you can do secondary DNB after that to complete your course. So that's how also the anesthesia was not my first choice. I got it. But now I'm happy that thank God I didn't go for gynae and I opted anesthesia.
Yeah, this is something which is very common. Even I always wanted to become a surgeon. My dad is a surgeon. And once I took up anesthesia and I also took in similar circumstances, I was only getting anesthesia. And so later on, I thought ki acha hi hua I didn't become a surgeon. So yeah, that is something which is it. Yes, Anu, tell us about you.
Yeah, I am from Kerala, sir. So I did my MBBS from Sri Gokulam Medical College in Trivandrum, Kerala. So I have completed my MBBS long back in 2016. And post internship I got for all subjects other than this medicine, which I wanted at that point of time. So I was so disheartened and I left studying for this NEET PG completely, and I thought I'll prepare for some time, and if I'm getting, I'll join for medicine only was my point at that time. Then along the course, it didn't what I felt was it didn't go as per my wish. So I had to take up a job and I moved to Bangalore for my work. So I worked almost for 5 years, and every year I used to write NEET. I'll get rank around some 20, 25 to 30,000 rank, which will not get this medicine. So I was just I thought I'll study, but then with work, the studying was not happening. And finally, when this course was introduced, even though anesthesia was not my choice, since it had some kind of patient interaction like medicine, I thought I'll just try because I wanted some skills also. So I took up without much of a thought, I've done my diploma from Jayanagar General Hospital in Bangalore. So after it was initially difficult for me because I was out of touch for studies from so many years, and initial part was little bit difficult. I had so many doubts, so much confusions, everything. And since anesthesia was not my choice, it kind of have chosen me is what I felt. Then it all went good. Now I'm happy that I've chosen anesthesia. I love, I'm happy to say that I'm an anesthesiologist.
Wow, wonderful. This is something, I'll tell you that most of the anesthetists out there are incidental anesthetists. I counsel hundreds of students every year, and I get probably one student every year who wants to take up anesthesia because they, while I am teaching, or whether they have been to the theater or their parents are anesthetists and therefore they want to take. Otherwise, everybody else in this world is an incidental anesthetist. but it is also the fact that I have rarely found an anesthetist who is not satisfied with his work, because our job is something which is it's very on the go. So what you do, the effect is immediate. So you get a lot of satisfaction. You induce, you do the case, at the end of it, you extubate, everybody is happy, even the patient is happy. So it makes one very, very happy, right? So that is also amazing to see that you have worked for so many years and then you opted for a seat, which of course it takes a lot of extra effort because you get out of touch with entire this terminology in the medical system. Nice. So I'm going to start with asking you few questions. You both have to answer them. And this is just our idea of understanding how students in NBE Diploma go about their course. So it's just a basic overview of everything that you did. So my first question is that did you feel that there was an initial anxiety in you regarding the new course? And what challenges did you face in the 2 years while you were working in a place where I'm sure even your teachers and the department would have not known much about what this course wants you to do?
Yes, sir. Actually, mainly about the exam, nobody knows about the pattern, even our seniors and consultants, because this was the first time. And about the diploma, I still have like a little bit of doubt of how much it is preferred in the outside, as in like in freelancing or in corporate sectors, or what is the scope after that. So my consultants have said that you have to do secondary, otherwise it is like not that much preferred in the current scenario. Otherwise, my institute was like, sir, there was like no bias between diploma and three-year degree courses. Students, they were treated equally and they were given equal hands-on.
Okay, that is very nice to know. What about you, Dr. Anu?
Yeah, it was almost same because we had seniors of DNB.
Okay.
Actually, they all had doubts about this course because this was a new, but there was not much of difference in terms of teaching or learning. It's
Okay.
just the exam which is different, which we had to complete in 2 years. Other than that, I didn't find any much of difficulty because in our hospital already DNB was there.
So it's
That is
always
one good advantage.
yeah.
Like,
So that means that this is one of the advantages of doing NB diploma from places which has DNB,
yes,
because otherwise I have few students who are in very small hospitals in very small places where there is absolutely no protocol. So they
yeah.
are pretty worried as to, because they are not even getting the skills that they want to learn. But the established DNB institute, I think NB diploma would be a good choice.
Yes, sir.
Now let's talk about your preparation. Of course, it's a short course and DNBs are in usually corporate or private hospitals, which has a huge workload and they don't have really too many people in the department, right? So it's all about efficiency. How much can they make someone work for how less money? And of course, PGs come first in this thing. So tell us, when did you start the preparation? What was your general understanding? When did you start reading? And how did you approach the academics for your exam?
So in the initial few months, I was only getting scolded in OTs, and I didn't even get that much time, and I was just happy that I got selected and all that. After a period of 4 to 5 months, they gave us PET exam. So in PET exam, I gave that exam without studying anything. Although the result didn't came of anesthesia branch only, otherwise other branches get the result, in which they failed, frankly failed those students. And as far as I know, and then they again after 5 months they gave us the internal appraisal exam. So it was like the second hit, and then I started studying for the exam actually. So mainly for the internal appraisal, because they were our own consultants and I know how badly they are going to scold me then. So I started taking it seriously, and in internal appraisal we were 3 students and I secured the highest, and actually I only passed the exam. So that gave me a little bit of confidence that yes, I won't get fail in main theory exam.
Okay. What about you, Dr. Anu?
Yeah, initially 3-4 months it was just going and coming back to OTs like that only. And whatever questions was being asked in the OT, I used to read it then and there only. Other than that, coming back reading was not actually happening. Then this FAT exam happened. Whatever I read like in the OT, I could write. The rest was all new to me. Then, like Garima said, it was like one internal exam we had. For that also, much of preparation was not there, but we were better prepared comparatively to the FAT because in our institute, we had a DNB, like we have a DNB professor, Dr. Rakhavendra Rao. He conducts exam every month, like for DNB and diploma students. He'll select past year question papers and questions and some 10 questions he'll conduct. Monthly exams were there for us. So it was even if we didn't want to read, we were forced to read for like 10 questions at least per month. So it used to help me like, and yeah, I also started studying after this second year, almost like second year beginning only. I started reading. I initially used to read the standard textbook. Then like I understood that I cannot finish like what are points like things which I used to love, I used to read in Stolting. Then I used to read Kaushik only from that time. Exam preparation I started from maybe our exam was in December, so we actually started reading from August.
August.
That it was like just reading.
No, but I'll tell you, you guys have still started way earlier than I did. My exam was in May, and I started, I think, in April when I was doing my diploma. DNB, it is a different story. By the time I started, I mean, my exams came in DNB. That by that time, I had already become a faculty for DAMS. So by that time, I remembered the entire book. So for DNB, I actually didn't read at all because I knew everything because I was taking classes every weekend. Nobody knew about that in my hospital, but I used to just do a Friday call and then go on a Saturday morning, do the class, come back on Sunday night and again join the department on Monday. So nobody had an idea that I am a teaching faculty. So DNB was a different story for me. But yeah, in diploma, I started about a month and a half before the exam. So you guys have started actually pretty decent. 4-5 months is it's a decent time to cover
No,
most of the
I
things.
started early because we thought exam was in October.
Then it's fine. I was wondering how come students have become so pertinent that for a December
No,
exam they need to
then
start.
like we got the dates very late and it was
Ah,
in December. Actual preparation was there only for one
I
and a half,
feel
two
I
months.
feel 2.5 months is like an ideal time to start.
Yeah.
Even if it is DNB, I mean, because just there is a difference between one paper.
Yeah.
Ultimately, the content and everything is absolutely the same. You just have to write 10 questions lesser. So, but you have to read everything in DNB. I saw the paper that you guys gave, and there was nothing that a DNB person will read and you will not read. So I think from preparation point of view, it's absolutely the same. But yeah, one thing is very good to see that both of your institutes, they conducted internal assessment exams, which is, I think, a very good impetus to start. And and I think FAT is a very good thing, isn't it?
Sir.
FAT is a very good thing.
Yeah,
Yes, yes.
it was just like a 1 day long theory paper.
Hmm.
3 years, sorry, sir. 3 hours straight, then again 3 hours paper.
Yeah,
And
yeah. I mean, in fact, in my time also in DNB, I think I became serious about studying in DNB only after I failed my first FAT. And I think everybody fails the first time.
yes, sir.
Nobody has any idea because everybody feels कि क्या है formative assessment, क्या करेंगे. And when the exam, and they are very harsh in checking the FAT exams. They don't give marks. I've rarely seen somebody pass a FAT exam. So what was your in general understanding when you started studying? Did you prepare a list of questions or topics or books you first collected material, or you just kind of started and then you thought कि देखेंगे क्या होता है?
So I asked my seniors how they have prepared for the theory exam. They have just passed that by that time. So they told me that you have to read Kaushik Jyotinath at least twice, and Tata for practicals, and Rashid Khan a little bit for airway. But the main thing was you have to revise Kaushik Jyotinath. Minimum 2 reads are required, and then you will start gaining like what it is written like pre-op or intra-op and post-op preparation. They will be same, and the difference is only you have to highlight in the second read that particularly like in tonsillectomy what you have to keep in mind. And Kaushik Jyotinath also had those boxes of anesthetic considerations. So just go through them at the end of the exam, at the end of the like before exam. It was like that.
So main source was Kaushik Jyotinath.
Yes, sir. And YouTube videos and sir, like your videos and mainly Nisora I watch for blogs.
Blogs, yeah. What about you, Anu?
Yeah, when I actually started to think about preparing, that time is the time when I joined for that Resident class. And module 1 and module 2 like helped me a lot because that was the basics. I have seen that 2 modules and then I started like to take the question paper. Like past 5 years question papers I have like just gone through, and first I like little bit of basics I had like because I was reading in between this whole thing, so it was there. And the rest of the things I could respiratory things I have completely was dependent on your class. It was very helpful for me because I have lost that touch long back. So it was like to very easy because you were teaching. I could have read that, but reading would have taken my so much of time. Watching your video like live, it helped me a lot. I can't tell how much it have helped because see, like I was out of touch for so long, and to get back in touch only it took some time. Then that video like reduced my time of preparation. Then like after watching the videos, I read this Kaushik once fully. Like I didn't read topic wise. I read system wise for some like 1 month almost. I took to finish that system wise reading once. Then it was almost like October, November, and like almost November mid. That time I have taken this past 5 years question papers, and then I read that past 5 years questions. Like articles also I used to read, journals also, and then mainly it was Kaushik only.
Yeah, I think one thing to summarize about the timing and your way of preparation is very standard. It has not changed in the last, what I gave back in 2017. So it's what, 7-8 years now. That for DNB, Kaushik Jyotinath is an excellent book, especially when you are starting pretty late and you have not in the habit of reading the standard textbooks and making your notes. So yes, Kejo is a very, very good book. Also, the fact that you need some push to start studying. So it could be anything. It could be watching videos on YouTube. It could be my resident class, or it could be any other thing that you have, excuse me, freely available with you. But yes, it is very important to start at some place. And lastly, 5 years of question paper is what DNB also says. And that is something that keeps getting overlapped. Now we will have more set of questions because now we have every year 6 sets of question paper of Diploma NBE that will also get added to this. But excuse me. But in fact, when I started studying, I did the same thing, both for Diploma and DNB. Is when I always started with questions. And if you see the evolution of my teaching in the resident class, the first few classes of module 1, they were all about the content, about the topic that I wanted to discuss. But immediately after 5-6 classes, I realized that am I audible?
Yes.
I'm sorry, I'm suffering from a very bad upper respiratory tract infection from a week. So it's just recovering now. So yeah, what I was saying was that, yes, So you would have realized that after 5-6 sessions, I also switched to that mode because I realized, but ultimately the idea of me teaching you guys apart from concept is that you should be able to write in the exam. What if you listen to 50 hours of my content, but at the end of it, you understand everything, but you can't reproduce it? Because exams is about reproduction of what you have read. So that is what then I did. I tried to summarize things in short, and we always started with the set of questions that have been asked in that particular topic, and then we discussed all those things. So that is actually a very, very good way. Both of you did it almost the same way, and I think your results are showing because there's a standard way. I cleared my DNB in the first attempt. You two have cleared it in the first attempt. And I think if you stick to this basic of reading a book like Kaushik Jyotinath or Tata ARC or even Yao and trying to do it 2 or 3 times and then keeping some material from outside which is not given good in these books and ultimately ending up doing the 5 years question paper. So this is what you did as far as preparation, and you said your seniors helped a lot. Now take me through the journey of practical exam, because we discussed individually on WhatsApp that till the end you had no idea how the practicals are going to be, whether there is going to be an OSCE or no OSCE or whatever. So tell me your journey about the practical exams. How did you go about it?
So in the FAT practical, I got the center at Bharatpur Government Medical College, and when we reached there, they don't have any idea that they have to take our practical exam today. So then they started, like, we left early, and from around 3 a.m. we left from Jaipur, and then we reached there at the right time, like about 7:30 or 8. It has to be started by 8, and they started it from 11. It was very exhaustive, but they asked the basic questions. Actually, they didn't have any idea how they have to take the exam, so they just take like 2 major cases, 2 minor cases, like that, and some instruments table, and 2 to 3 instrument table and ECG, X-rays and all. But when I gave the internal examination in my own institute, they take it very seriously because they know how is the DNB pattern and all. So it was like that. Excuse me, sir.
Yeah, no problem.
Please. So, sir, they kept everything like from IGEL, all types of LMA, all types of ETT, double lumen, and arterial, and they asked the maximum they can. And they also place the dummy, they make us practice about the CPR. And one external was called from SMS college. Our 2 internals were sitting, and it just mimic the same exactly how the real exam is going to be. So it was a good practice for us. And then in the final exam, I got in Pune. It was very far. So a little bit of anxiousness already was there because I don't know how the hospital will be like, and all one day before we reached there, and the tempo was also, we lost the tempo of like reading again and again because there was a gap of about 2 months in between. So I almost felt like I have to start it again. And 10 days before only they gave us the date that you have to come there. Then in the main exam, they kept like 5 stations, and even like 5 days or 7 days before, we got to know that there was no OSCE. Because the other people who gave the exam first, they cleared us actually that there will be no OSCE in diploma.
Achha, you were in the second slot.
I was in the second slot, and then a little bit of they were all telling how is the exam, and there will be 2 major cases and like that. So the cases were distributed like there were 4 cases, 50 marks each, and there were 5 stations, 20 marks each. And there were 3 externals and 1 internal of the same institute, and they give us like the live cases, all kind of cases, like depending upon the institute. That our institute also had cardiac cases, and instruments and ABGs, PFT, everything they have asked. ICU especially, and in ICU, sir, your videos I have watched in the ICU. For ICU, Otherwise, I haven't read any book. Like my seniors have told me to read Paul Marino and all. But some ICU like core topics you have covered in that, like sepsis and everything. So that I have made notes and I have only revised those. So they were really helpful at that time.
That is very nice to know. How about you, Anu? How did you approach practicals?
Practical, it was first practical I was appearing was for FAT. That FAT practical was in our like district only, like, and it was in a nearby hospital. So same, it was a government setup. Everything was same. The cases which we see and they see was the same. So there was not much of a difference, and I felt it is same. I didn't find any difficulty at that point of time because it was all same. Both were government hospitals. So cases were also similar. Internal exam also went like that only. But when the practical exam happened, one thing like Garima said, it was like 5 months after the theory exam, almost 5 months. So that gap was there. The reading, like we were relaxing actually. Post theory was like very much stressful because it was first batch, and we didn't know like how it will turn out. Whether this tension was there, whether they'll correct properly, like whether they'll be liberally correcting. So many confusions were there. So to get that settled only, like theory, after theory results came only, that settlement came, that finally we passed. To settle in, it took another like again some time. By that time practical dates came. Then it was all a hurry. Like we didn't know like whether OSCE is there or not. We were first told to prepare for OSCE. Then we were preparing. Then again, like we got to know when first batch of students appeared that OSCE is not there. But then 4 cases were there, which was not expected. Like all the 4 cases were long cases only. It was not nothing like short case, long case, nothing like that. And I got a center in Hyderabad, from Bangalore to Hyderabad. And I got in a corporate hospital. I got in Yashoda Hospital, which was a high volume center. They had all kinds of cases which we were not exposed to be honest. So that tension also was there. So the cases which I got was like I have never seen prior in my like PG days. It was like lobectomy and all, which was not being done in our hospital. But still I could manage with all the, like, it's nothing like something extra like they were asking. Theory part they were asking, but finally whatever I could say, what we were doing in OT, I did that much. This 5 session part, like post this case, OSCE was not OSCE, the Viva sessions were there. That was divided into 5 parts. Like that was basic, I guess, like drugs, ECG, like PFT, X-rays. That and all was fine. Only this thing, like the case, was very new to me. That's all. Somehow that also.
Yeah, I mean, this is this is something which is one realizes only after they have passed it, that we fuzz a lot about cases in the practical.
Yeah.
But I think we discussed this thing that cases are actually not that difficult because they don't really stick to too much of history taking and negative history and stuff like that. Even if you miss a point here and there, they are fine. But all a DNB practical examiner is concerned about is whether you will kill the patient on table or not. So their entire viva revolves around the fact कि अगर कुछ हो गया तो आप बचा पाओगे कि नहीं patient को. And I tell all the students to just make sure that they don't utter something blunderous कि patient जो है उसको heart rate is going lower because of high spinal and you will give IV adrenaline. So that is going to kill the patient because of VT. They just don't want to hear that. So
Yes, sir. As does like intra complications, mainly related to the case. I got the sickle cell anemia in pregnancy. Yes. So they have asked that what will be the factors that you will avoid at that time, like to avoid that crisis. And intra-op mainly they were asking, and they also asked about the like intra-op management, like what like plan of anesthesia, like okay, you want to do this cesarean in spinal, but what if I say that you have to do it in general anesthesia, and what will be your considerations like this?
yeah. So basically, they just want to know whether you have been in the theater or not. That is my idea. That is my understanding, because my examiners also ask me the same things. And once they get an idea that, okay, you are not going to kill the patient, you have spent enough time in the theater to know how change in the hemodynamics look like, how IV line look like, how fast fluids look like. And so then they get satisfied, okay, because they have a big moral liability, because when they say pass, you guys are going to come out into the society and start practicing as an anesthetist. So if they give somebody pass who doesn't deserve to be out there, who has not the required skill to save a patient, then the onus lies on them. So I always think in the psyche of the examiner. That helps us a lot in answering in the exam, right? So this is very wonderful. You guys have been actually flawless. Your preparation was very good. Now I feel that you did not need much of my help during the preparation time, but you were very lucid about it.
Have always been useful. Even if I do secondary, then also I have to watch your video, because they are the basics and we tend to forget those things. And especially the vaporizer, I didn't understand from any of the YouTube video. I even asked my senior about it. But the table concise that you have did, that was very, very excellent, sir.
Vaporizer was actually my favorite topic in first year of my diploma. From first year of my diploma, I have been teaching vaporizers. I taught all my MD seniors also vaporizer when I was doing. It was something which was, because everybody kept saying कि vaporizer समझ नहीं आएगा. So I was like, ऐसी क्या चीज है कि समझ में नहीं आएगा? I kind of took it as a challenge, and physics was something that I always liked. So when I started reading, I actually read it from, I think, 5 books in the time of my diploma. I got some books from the library and then I downloaded certain books and I read a lot of books just to understand कि इतना क्या हो सकता है vaporizer में. And ultimately I realized कि it's all physics, nothing else. It's a medical equipment, but it is entirely based on physics. And but once you understand it, it's one of the most beautiful concepts in anesthesia. Then you actually see, when you move the lever, you actually see the mechanism changing and you see vapors going. So it feels good.
So after that, I started appreciating, okay, what is I am doing.
Yes. So now that you have finished your diploma and now you must be little relaxed, but what about next? What is the next target? PDCET?
Yes, sir. PDCET is like on 21st July only. So
what's your approach? How are you approaching PDCET?
So that the question is, मैं आपसे पूछना चाहती हूँ how to approach it now, because
it's very simple. One, you have to understand that the pool is very smaller now. You don't have to fight general public for a seat. There are a lot of secondary DNB seats. Almost every institute has a diploma, has now a secondary DNB as well. So there are a lot of seats, about 350, 400 seats in India in secondary DNB. And the number of students who are appearing are actually very less. Maybe from your batch, the NBE diploma is going to get added. Otherwise, only government diploma students used to appear for DNBs. But now what has happened is, when they introduced this NBE diploma in your batch, they decreased the number of diploma seats in the government hospitals. So the diploma that I did was the government diploma. And now they have decreased it a lot. Now they have converted all those seats into MD seats. So again, the pool is the same. So you would be about 500 students in India, 500, 600 odd students in India who will be fighting for 300 seats, which is like the best odds of getting a seat in India. मतलब इससे आसान और कुछ नहीं हो सकता. We are used to 10 and 100 times more than the number of seats, the number of students who are appearing. So one, it is very easy. Secondly, the pattern of exam has also become very easy. Now they ask you only anesthesia. When I gave my PDCET entrance exam, it was 19 subjects. So I had to actually sit and go back and read ophthalmology, PSM, gynae, medicine. But again, it doesn't matter because the entire pool is the same. So even when I did my PDCET, it was like I had people who also didn't know anything. I didn't know anything. So I was like better amongst the worst kind of a thing. So you have to remember, it's in general an easy exam. Now, the only thing is, the more you prepare, the higher your chances are taking a very top-notch DNB institute, which will add a feather to your cap, and you will get a lot of exposure. Because if you are from some institute which is a top-class DNB institute, the opportunities that you get in life are amazing, because those are the contacts that you make. Like I did my DNB from Hinduja Hospital, Mumbai, and that is like one of the best institutes in India. It's one of the best hospitals in India. So I know the best in anesthesia, the best in surgery, the best in orthopedics, the best in cardiac surgery, because I've worked with them and you forge a bond with them over 2 years. So the only question is, how much are you ready to put in the effort? So it has to be very basic. Now that you have got time, you can flip through the pages of standard textbooks. You don't have to really go on and read anything. Just flip through Miller's and Morgan's, because a lot of questions are directly asked from these standard textbooks. And pay a lot of emphasis to CPR, because CPR is a topic which from last 3 batches, the students who have entered they have told me that lot of at least 10 to 15 questions are from CPR. So every single nook and detail of ACLS and BLS guidelines, along with all the associated scenarios of stroke and foreign body obstruction and symptomatic bradycardia and tachycardia, and the relevant part in the ICU, that is the drug management. So whether it is IV adenosine or it is adrenaline or vasopressin, and depending on whether it is last, so you will give intralipid. So try to understand that resus and complication again forms a very big part of this entrance exam, because again, they want you to just know whether you can make the patient live or not. So you don't have to really stress too much about the PDCET exam per se. But yes, you have to keep flipping your pages and you have to keep revising the theory part that you did. The Kaushik Jyotinath or the Tata ARC, you keep just flipping it. Everything will ultimately come from there only. And we have some certain MCQ books which are floating around, those 1000 MCQs of FRC and all, although their standard is too high. So what you can do is you can scan them. The question that you understand is the question that you practice, because there are a lot of very high fundu ICU questions in them which are never asked to us. So when you read those MCQs, just remember, if you see a question and you feel कि ये question समझ में आ रहा है, कि मतलब ये anesthesia का question लग रहा है, तो उसका आप पढ़ लो, उसका explanation पढ़ लो, उसका answer पढ़ लो. But if you read a question and you feel कि ये तो this is something alien, so then you can leave it, because that high level of questions are never asked in this exam. And trust me, even if it is asked, no, it doesn't matter, because if you don't know it, nobody else is going to know it. Again, I told you, the pool is the same. Everybody is like you only. मई में एग्जाम हुआ है, मई में क्लियर किए हैं और जुलाई में एग्जाम है. अब उसके बीच में नौकरी भी करनी है, मस्ती भी करनी है, सब करना है. तो ऐसा कोई बहुत पढ़ के आ रहा है ऐसा नहीं होता है इसमें, है ना?
Just
Yeah.
had one doubt, as in like, can't we write like normal NEET and get a MD anesthesia seat, which will be a 2 year?
Yes, you
Will
can.
be a 2 year.
2 years of
Yes, you
That
can.
is the doubt which everyone of our batch has, because there is no clear guidelines saying that we can write. So are we eligible?
See, I'm not sure about NBE Diploma.
Yeah, that is
Because NBE Diploma people have not yet clarified whether they can give 2-year MD or not. But if you have done normal diploma, then this is a very normal thing that you give NEET and then you do 2-year. But my suggestion is not to do that.
okay.
See, a DA-DNB has much more value than a MD. I'll tell you the reason why. MD is stuck to government hospital. Their protocols are government, their structure is government, their equipments are government, they are only government people. But when you do DNB and diploma, they know that you have been to everything. You have seen everything and your training is 4 years. You have done in a good corporate, you have done in a semi-good corporate, you have done in a good corporate versus you have done in a government. So like I have always been respected more professionally because I am a DA-DNB as compared to somebody who is a plain MD. So if at all you have to do now, it's always better to do DA-DNB. Anyway, the exam is easier. Why do you want to go back to NEET, whose level has become now huge? It has become so much that you will not be able to clear it that easily. And what if you get a good rank in it? That is also a big problem. See, try to understand. First, you spent 2 years studying for this exam. Then you did 2 years of diploma. Then you waited 1 year. Then you gave NEET. And by chance, you got a good rank. Suppose you got a rank of 4,000. Now you are getting all the other options. Now you will again get confused. Now you will say, okay, I'll leave anesthesia and I'll go to some other specialty. So you will end up wasting the 5 years of your life that you have spent earning and learning something so beautiful. And you know, nobody deserves that because you have spent not only time, but a lot of resources in learning it, but all of that will go to waste. So unless and until you inherently don't like to be an anesthetist, there is no need for you to go for NEET. Make your life simple. This July you give the exam, August the result will come, September you join DNB. Why waste a year more? You know, because it is very easy to clear a secondary DNB exam. Very, very easy. And when you go for DNB exam, theory, practical, 2 years later, you will be a pro in it because you have already given it. So it's like giving 2 exams. So your theory will be better. Your practicals would be better. Now you will have a better understanding. Now when you are in the OT and you see a change in capnograph, as compared to somebody who is doing a primary DNB who has no idea what is happening, you will have every idea what is happening. So you become a better clinician because now you have a backing of theory and you are still a resident. So a resident has to work a lot. So nobody is a junior to you. You are the junior most in DNB as well. So because you are a junior, you work a lot, but now you have the backing of entire knowledge of anesthesia. I'm telling you, secondary DNB will be the best 2 years of your life because you know everything and yet you are getting a chance to learn. So there's nothing beautiful than that. When you do a next aneurysm, so you know the entire CPP and ICP and factors affecting ICP and factors affecting CCP. So when that happens in front of you and you see the consultant doing something, you know the entire mechanism and that you will never forget in your life. So a secondary DNB not only makes you an MD equivalent, but it makes you a very good anesthetist because you will apply your knowledge practically for 2 years.
Yes.
And then you will simply walk and you will give the theory exam and come back and practical exam. Why? You have already read everything. You have already crossed this entire stage. Only thing new would be maybe OSCE. So that is not a big deal. OSCE is actually very scoring. Once OSCE has come, the role of examiners have been reduced to just 20% in the exam because if you do good in OSCE, nobody can fail you.
Yes.
Out of 200, if you have scored 140, then the rest of the 300, you just have to score maybe 100. That is 1/3 marks. And if you just go and tell your name correctly, they will give you 1/3 marks. That is my understanding.
Sir, other option like after DA is if I do like IDCCM, I want to go in ICU, then how
Not
will it be?
advisable. You will forever be inferior to everybody around you. IDCCM after diploma is not a 1-year course, it's a 2-year course. But even after 2 years, they don't respect you because they say ki nahi, you are not completed your degree, you are diploma and 2-year IDCCM. Also, IDCCM has no standing in corporates anymore because IDCCM according to them is cheap labor in ICU. So they will end up making you only do ICU duties forever in your life. 8-hour shift. If you want to become a consultant, if you want to go one notch higher where you become the consultant, you take the rounds, you get admission rights, you have to do a formal either DNB super specialty in critical care or DM in critical care. Now, no IDCCM person gets a consultant post. That is now gone because there are so many seats of DNB super specialty. They have spent 3 years with that. And I have also on YouTube, there is a video that I have recorded with all the. You have watched it, no? Yes. So you must be knowing.
So that also decided, okay, now I should do secondary DNB.
Yes. First do DNB, complete this part, and then forever in your life, you are free to do ICU. But don't compromise on these 2 years to save some 2 years later on. It's not going. You will forever be unhappy because you will be surrounded by people who are inferior to you in knowledge, which are less hardworking, which don't deserve to be there, but simply because they did a degree better than you, they are there.
Yes,
so at this stage, it is not advisable for anybody to just stick to IDCCM if they want to be in critical care. Suppose I want to do IDCCM, that is fine. I'm a freelance anesthetist. So if I do IDCCM for a year, it gives me the required expertise to manage my own ICU. So for me, it is okay. But if you want to work in a corporate hospital or in a medical college, IDCCM has no value.
Okay.
So it was wonderful talking to you, both of you. And I'm very, very happy. You are my first batch students who have passed the exam in flying colors. So it makes me very proud as a teacher. And we'll again have this thing again after 2 years when you guys will be doing your final exams of DNB. And we will reminisce this time, right? So thank you so much, both Anu and Garima. It was wonderful that you found time for us. And I hope this video is helpful for all those students out there who are doing diploma and who feel that it is very difficult and नहीं हो पाएगा, नहीं कर पाएंगे. So they'll realize कि नहीं, 2.5-3 महीने में आराम से you can clear this exam. है ना?
Yes, sir.
Thank you. Thank you so much. And God bless you both.
Thank you, sir.
Without your support, this wouldn't have been possible.
Thank you. Thank you. Thank you. Thank you so much. Thank you so much. Yeah. Bye. Good night.